In a Neolithic burial in eastern France, archaeologists pulled a 7,000-year-old skull from the dirt with 2 perfect openings cut into it, and the bone around both openings had grown back. The patient had survived. In a museum in Cairo, there is a wooden toe attached to a mummy's foot with leather straps. The wear marks show she walked on it for years. In a cave in Borneo, a young hunter-gatherer lay buried with most of his left lower leg missing. The end of the bone was clean, healed and rounded. He had lived for years after the surgery, and he had lived 31,000 years ago. Today, we will look at 7 medical procedures performed thousands of years ago that should have been impossible. Each one is real, each one left physical evidence behind. Each one was done without microscopes, without antibiotics, without anesthesia as we know it. And yet, they worked. The question is not whether our ancestors were skilled, the question is how much we have convinced ourselves they could not have been. In 1997, a German research team led by Kurt Alt of Freiburg University reported on a skull that had been excavated from a Neolithic burial site at Ensisheim, in the French region of Alsace. The skull belonged to a man who had died at around 50 years of age, sometime between 5,100 and 4,900 BC. The man had 2 openings in his skull, one toward the front of the head, measuring about 6 centimeters across, a second one further back, even larger, nearly 9 centimeters. Both openings had been deliberately cut. And here is what stopped researchers cold. The front opening had healed completely. The bone around the edges had regrown, smooth and rounded. The second one had partially healed before the man died, probably from causes unrelated to the surgery. This is trepanation, the practice of drilling, cutting, or scraping a hole in the skull while the patient is still alive. To do it without killing the person, you have to know exactly how thick the bone is. You have to stop at the precise moment your tool reaches the membrane underneath. Cut too deep, and you damage the brain. Cut too shallow, and you cause infection without solving the problem. The tools available in 5000 BC were flint and obsidian. The patient was awake. There were no antiseptics, there were no painkillers we would recognize today, and the operation worked. Twice. On the same man. The Ensisheim Skull is now considered the earliest unequivocal evidence of successful trepanation in the archaeological record. We do not know what condition the surgeon was treating. Head trauma, headaches, pressure on the brain. What we do know is that someone in Stone Age Europe looked at a sick person and decided the answer was to open the skull, and they were right. In 1914, the Austrian archaeologist Hermann Juncker was excavating the Great Cemetery at Giza, near the pyramids, when his team came across 2 human teeth bound together with a thin strand of gold wire. The teeth, a lower second molar and a lower third molar, had been carefully drilled, threaded with the wire, and tied to one another. They were not from the same jaw. One had been transplanted from somewhere else, possibly from a fresh donor, and held in place by the wire as an anchor. This is a dental bridge, the same procedure your dentist performs today with the same logic. A missing or failing tooth is replaced. The replacement is fixed in place by attaching it to a healthy neighbor. Now, scholars still debate one question. Was this work done while the patient was alive, or was it added to the body after death, as part of the elaborate Egyptian preparation for the afterlife? Some experts argue the wire was twisted around the teeth in life to hold a loosening tooth in place. Others believe it was a posthumous restoration, done so the body would arrive in the next world complete. What no one debates is the principle. Someone in the 3rd millennium BC understood that you could anchor a tooth to its neighbors with metal wire. That mechanical idea is still in your mouth today, every time a dentist installs a crown, a bridge, or a splint. The Egyptians worked it out 45 centuries ago. The piece sits in the Egyptian Museum in Cairo, and the gold has not tarnished. On a mummy in the Egyptian Museum in Cairo, attached with leather straps to the right foot, is a carved replacement for a missing big toe. Made of wood and leather, shaped with care, articulated in 3 pieces so that it bends when the foot bends. The mummy belongs to a noblewoman named Tabakatenmut, the daughter of a priest who lived around 1000 BC. The toe was first noted long ago, but it was only in the early 2000s that researchers re-examined it closely and realized what they had. It was easy to dismiss as decorative, but the prosthetic showed clear signs of wear. The wood was polished from contact with the ground. The leather straps were creased exactly where they would bend during walking. Small adjustments in the shape aligned with the curve of her remaining foot. In 2011, researchers at the University of Manchester built 2 replicas of the toe and tested them on volunteers missing their own big toes. Both replicas allowed the volunteers to walk comfortably in sandals of the kind worn in ancient Egypt. The design worked. It was not symbolic, it was engineering. The big toe carries a significant share of body weight during walking. Without it, balance changes, gait changes, and the rest of the foot takes on stress it was not built to handle. The Egyptian craftsman who made this prosthetic understood that. He compensated for it. This is, by current evidence, the oldest functional prosthetic limb known to history. Tabaketenmut walked into her tomb on a working artificial toe. Look at your own foot for a moment. Imagine losing one toe and having someone hand you a piece of wood that lets you walk again as if nothing had happened. Then imagine that happening 3,000 years ago. In northern India, around 600 BC, a physician named Sushruta wrote a medical text called the Sushruta Samhita. It was an encyclopedia of surgery. Over 300 procedures, more than 120 surgical instruments, and detailed instructions for setting fractures, removing bladder stones, and reconstructing missing body parts. One section described a technique for rebuilding a nose. In ancient India, cutting off someone's nose was a punishment for adultery and theft. The disfigurement was permanent and socially devastating. Sushruta laid out a procedure for repairing it. The surgeon would take a section of skin from the patient's cheek or forehead, leaving one end still connected so blood could continue to flow into it. He would then fold this flap of living skin down over the wound, shape it into the form of a nose, and stitch it in place. This is the foundation of modern plastic surgery. The technique is called a pedicle flap, and it is taught in medical schools today under exactly that name. For more than 2,000 years after Sushruta, this method continued to be practiced quietly in parts of India. Then, in 1794, a British surgeon named Joseph Karpue saw a man in Pune whose nose had been rebuilt this way. The result was so good that Karpue spent 20 years studying the method. The British medical community received it as a revolutionary new technique. They called it the Indian method, and the name stuck. Sushruta had described it in detail more than 2,000 years before any European surgeon performed it. His manuscript still exists. The technique still works. If the medicine you were taught in school feels like it skipped a few thousand years, you're right. Subscribe to Sapiens Occulta. We read the chapters that didn't make it into the textbook. Why do you think Sushruta's technique was forgotten in the West for 2,000 years? Leave your answer below. In 2020, a team led by Australian archaeologist Tim Maloney was excavating a limestone cave in the rainforest of Borneo when they uncovered a human skeleton, a young hunter-gatherer who had been carefully buried about 31,000 years ago. The lower part of the left leg was missing. What made the discovery extraordinary was the bone. The end of the tibia and fibula showed full healing. New bone had grown over the cut. The edges were smooth, rounded, and reshaped by years of weight-bearing. This person had not died from the amputation. They had lived for at least 6 to 9 more years afterward, until 2022, when this case was published in Nature. The earliest known successful amputation was thought to come from medieval Europe, about 1,000 years ago. The Borneo skeleton pushed that date back by 30,000 years. A successful leg amputation is not a small thing. In any era, the risks are catastrophic. Major blood vessels run through the leg, and cutting them without a way to stop the bleeding kills a person within minutes. Even if you survive the surgery, open wound is an entry point for infection. In the era before antibiotics, infection from amputation killed roughly half of all patients well into the 19th century. This patient survived in the late Stone Age, in a tropical jungle, 31,000 years ago. To do this, the surgeon had to cut through bone cleanly without shattering it. They had to control bleeding. They had to keep the wound clean, possibly using local plants with antiseptic properties, of which Borneo has many. They had to manage the patient's pain enough to operate, and they had to know what they were doing. The cut was deliberate, precise, and survivable. Someone in a society that had no agriculture, no writing, no metal, looked at a damaged limb and made the decision to remove it cleanly, and the patient walked out, on one leg, into the rest of their life. In the late Han Dynasty, around 200 AD, a Chinese physician named Huatuo developed an herbal preparation he called Ma Fei Zan. It was a mixture of plants designed to do something no Western medicine would manage for another 17 centuries. Put a patient completely to sleep, so deeply that the body could be cut open without pain. According to 2 of China's official histories, the records of the 3 kingdoms and the book of the later Han, Huatuo used Ma Fei Zan to perform abdominal surgery. He would dissolve the powder in wine, give it to the patient, wait for them to lose consciousness, and then make incisions, remove diseased tissue, and stitch the wound closed. Historical accounts describe successful recoveries, with patients waking days later and resuming normal life. This is general anesthesia, the defining procedure of modern surgery, the thing that allowed Western medicine in the 19th century to finally enter the body without killing the patient from shock and pain. The exact recipe for Mafesan was lost. Hua Tuo, according to legend, was executed by the warlord Cao Cao after refusing to remain at his court as a personal physician. Before his death, Hua Tuo gave his medical writings to a prison guard, who refused to take them out of fear, and Hua Tuo's wife, frightened, burned the papers. What survived was the testimony of the historians who recorded his work. We know it happened. We do not know exactly how. Modern researchers, working from the surviving descriptions, suspect the mixture may have included cannabis, datura, monkshood, and other plants known to alter consciousness, but no one has reproduced the original. Until 1846, when ether was first used in Boston, no Western surgeon could put a patient to sleep deeply enough to safely open the abdomen. Hua Tuo had been doing it 1,600 years earlier. In the high Andes of Peru, in the years before the Spanish arrived, Inca surgeons were performing operations that would not be matched in Europe for another 400 years. Excavations of Inca-era cemeteries have produced more than 800 trepanned skulls, far more than have been found in the rest of the world combined. The survival rates are extraordinary. In the Inca period, between 1400 and 1500 AD, studies have found that roughly 75 to 83% of trepanation patients survived. By comparison, during the American Civil War, 400 years later, cranial surgery still killed nearly half of all patients. But within this larger record, certain skulls stand apart. There is a skull belonging to an adult man who underwent 5 separate trepanations in his lifetime. 5 different openings in 5 different places on his head. Every single one of them shows complete bone regrowth around the edges. Smooth, healed, rounded. He lived through every operation. He lived long enough after the last one for the bone to seal itself again. This is not a one-time desperate attempt. This is a routine medical practice with a known success rate, performed by surgeons who had refined the technique across centuries. The Inca had access to coca leaves, which contain cocaine, a powerful local anesthetic that also reduces bleeding. They had bronze surgical instruments of high quality. They had a tradition of military medicine, forged by centuries of high-altitude warfare. The skulls sit in museums in Lima and Cusco today. The cuts are in the bone. The healing is in the bone. 5 holes in one head, and the man walked through it all. We have crossed 7 thresholds. A drilled skull in Neolithic France, a gold-wired bridge in Giza, a wooden toe walking through Thebes, a reconstructed nose in northern India, an amputated leg that healed in a Stone Age jungle, a patient sleeping under cannabis and wine in China, a man with 5 holes in his head, walking the high Andes. Every one of these procedures left physical evidence behind. Every one was performed on a real human being who, in most cases, walked away alive. We can stand in front of the skulls. We can hold the prosthetics in gloved hands. We can read the manuscripts. What none of these cases requires is a leap of imagination. They are documented. They are catalogued. They are sitting in museums right now. What they ask of us is harder. They ask us to admit that the human body has been understood for a long time. Not as well as we understand it now, but understood, studied, repaired, modified, saved. The hand that drilled the Ensisheim Skull belonged to someone who did not have our books, our schools, our microscopes. They had a body in front of them, a problem, and a willingness to act. The patient lived. That is the whole record. Modern medicine is not the moment we learned to heal. It is the moment we wrote down what humans have always tried to do. Which of these 7 surprised you most? Tell us in the comments. We do not know what knowledge our descendants will think we lost, but we know now that they will be wrong about us, the same way we have been wrong about the people who came before.